Alrighty, y'all, so let's have a difficult conversation. I'm wearing my referee's outfit for a reason because we have to referee some of these things back and forward. Let's talk about your adult children. So the first part of this talk is going to be for the parents who are so well-meaning and wonderful. The second part will be for the kiddos that we're trying to reach. And so for the parents that are so well-meaning, thank you so much for advocating on behalf of your adult child. Yeah, and we're super glad you're here. Now the hiccup is adult children have the right to complete privacy, complete confidentiality. At the stroke of midnight on their 18th birthday, pretty much in every state in the United States, they get the exclusive right to manage all of their medical decision making. And that includes stopping medicines, starting medicines, changing medicines, adding medicines, that sort of thing. That is something that no doctor can change because it supersedes our state-based ability to do that. So the only time that we can go outside of those things, depending on what state you're in, is if there's a danger to self or others. So for example, if your adult child is at school and you're worried about them, you have the right to call for a wellness check at the school. You also have the right to call their psychiatrist or whoever is treating them and say, hey, have you heard from them? Here are my concerns. And most likely that person, that doctor or psychiatrist, nurse practitioner, whoever, will reach out to the person directly and say, hey, your mom is calling, your dad is calling, please contact them. If that person, that licensed professional, then has an issue or a concern about safety, then they will reach out to the school or they'll reach out back to you. But the thing to remember is that confidentiality, privacy stuff is like ironclad. Like if we violate it, it's like $25,000 fine for every hit, every time that violation occurs. And so you're not going to see a whole bunch of folks who are willy-nilly with this stuff. We will make you sign paperwork, both yourself and your adult child, so that everybody understands that we can't just break that confidentiality. Now, with all that said, one of the other hiccups that a lot of my parents have is they say, well, I'm paying for everything, so I have the right to know. And unfortunately, that is not the case. And so, yes, I appreciate you paying for appointments. Having that credit card on file makes our lives a lot easier, but it does not give you any right to their medical information. The way that it works for most people, most circumstances, is that the adult child has to sign permission for us to talk to you. But that permission slip, that release of information, is not carte blanche, meaning it doesn't just open, or tabula rasa, it's not just open to for us to talk about whatever. The person, the adult child, will then dictate to us, hey, I want you to only talk to my mom about school, or only talk to my mom about this one particular thing. It doesn't open up the can for everything. And so just be very thoughtful about that, because if we do have that release of information on file and you call and you say, hey, how's school? If I have permission, I'll talk to you about school. If you then say, oh, well, what about their relationships? Or are they, what have you heard about X, Y, and Z? I'm then obligated to say, well, I don't have permission to talk about that stuff, so I can't really tell you. Please, consult your adult child. One of the last other big things for parents on the parent side of things is that a release of information is not medical decision making. It is not a power of attorney. And so power of attorney, basically, if you have a medical power of attorney, you can make medical decisions on behalf of someone else. That is not what a release does. So in other words, if I'm talking to you on the phone and you feel that it would be helpful to go up on a medicine or change a medicine, I cannot do any of that until I actually talk to your adult child, because they have all of the legal responsibility and medical decision-making power. If they choose to stop their medicines, even if I feel it's a bad idea, it doesn't matter. They still have the right to do that. I often say in this country, you have the constitutional right to make a bad choice, and you do, unless it's a danger, unless it puts you in a danger to hurt yourself or someone else. And then, again, in most states, your psychiatrist, whoever your treating clinician is, can kind of jump in and prevent that from happening. And so, yeah, so it's really, really tough. We have lots more information about kind of some of the legal hurdles that we have to jump through on our website. By all means, make sure that you talk to whoever your clinician is, because if you're watching this video and you just happen to be in a different state than Texas, the rules may be a little bit different. So make sure to talk to the person that's in your state, because they know the jurisdiction and the jurisprudence really well. And just know that we really do appreciate everything that you do for your kiddo. And keep doing that just to help us help you. Alrighty, so that for the second part of the video, this is towards the kids. So if you are 18 or older and your parents are being so gracious as to help you, well, congratulations, that's awesome. It's always good to have a support system that has your back. However, there are a couple different things that I need you to keep in mind as an adult child. So number one, it is a developmental milestone for you to be able to manage all your stuff. I expect you, and most doctors will expect their adult patients to know what medicines they're on, what doses, when the last time you filled it, what they do, what they don't do, the risks and benefits and side effects. Like, that is something that you should know. That should not be delegated to your parents or to whoever that caregiver is. And so we're going to encourage you to keep that in mind. The next part is, it is up to you to schedule all your appointments because you know your schedule. And so yes, a lot of parents are very on it. You know, they're using their Google calendars and the family calendar and all that stuff. But your psychiatrist, your treating clinician is always going to look to you because legally you're the only person that can do it. You're the only person that can make an appointment that you keep. You yourself are responsible for paying for the appointment. Now, you may have other arrangements with your parents of, hey, I want to have their credit card on file, or hey, they'll send the check, or, you know, hey, here's cash or whatever. But that falls on you to do, not your parents. And so we're going to really encourage you to keep that in mind. Also keep in mind, we cannot talk to your mom or dad or whoever your parental figure is without your express written permission. And we can only talk to them about the things that you dictate to us we can talk about. So it is not an open season of information. If you tell us we can talk about one thing, that's the only thing that we can talk about. What I tell a lot of my adult children is that I can always receive information. So if your mom, your dad, your girlfriend, your boyfriend, your boss, I don't know, whoever wants to send information to me on your behalf, feel free. They can send it to me. If I see anything concerning, I'll reach out to you and say, hey, your boss called and said X, Y, and Z, but I can't go back to them directly and say that you're a patient, that I work with you or anything. It is a solid wall of, I can neither confirm nor deny that so-and-so is a patient under my care. Again, the only time we get that wiggle room is if you're a danger to yourself or someone else. And then in the state of Texas, I can kind of wiggle around those confidentiality rules to keep you safe. Again, check with your particular state to make sure that what the rules are in your state. But I need you to be assured that your privacy, your confidentiality is ironclad. So for example, if you're smoking weed and your parents are like, you know, so-and-so needs to stop smoking weed. Well, I'm not at liberty to talk to them about that. I'm going to talk to you and say, yeah, you should probably stop smoking weed. It's not really helpful in the grand scheme of things. But I'm not going to force or report anything to them unless it's putting your life in danger. And so you should feel comfortable talking to whoever your clinician is, that you are being heard and validated during your appointments with us. And then that last part is, yes, make sure that any of the financial obligations that you have in seeing a clinician that you take care of, because we are small businesses and we're just trying to keep the doors open. And so anytime that there's a decline card, anytime there's not a card on file, anytime that there's a disruption in prompt payment, it just creates havoc and chaos. And so as a responsible adult, which is what we're hoping that you will be, that you will make sure to keep all of your financial status stuff in good standing. Alrighty, and so as you can tell, there's two parts to making sure that adult children are taken care of in any mental health practice. So the kind of the parent part, the adult child part. If you have major nitpicky questions, you can always consult a lawyer because they can help walk you through medical power of attorney, guardianship, all of those types of things. If you have clinical questions about how all this stuff works, talk to whoever is right in front of you, your psychiatrist, your counselor, your therapist, physician assistant, nurse practitioner, or whoever. And then just know that we at Simply Psych, we are trying our best to get everybody their best fit therapist, their best fit mental health clinician nationwide. And so make sure to follow us on www.simplypsych.com or any of the social medias. And we really appreciate you being here with us.